My name is Paul Casey. I'm the acting chief medical officer at Rush University Medical Center. And I just want to provide a brief update on COVID as it's been a few months. And last we had an update, we were in quite a different situation than where we sit today. I think there's a couple aspects in terms of what we know about COVID now that we didn't know a few months back. One piece is that we certainly know that the mitigation steps that were put into place, so social distancing, wearing masks, meticulous hand hygiene, those things are incredibly effective at preventing the spread of COVID when done well. So that is certainly something we've learned, and certainly something that Illinois as a state has benefited from, unlike some of the other states where we're seeing mounting cases at present. I think we've also learned that COVID is a serious illness, and while most individuals that get COVID, it is an influenza-like illness and they recover well at home. There are individuals that become quite sick from COVID, so it certainly is not something to be taken lightly. And I think anyone that's been exposed or anyone that's had COVID will tell you the same, that really we need to continue to take COVID incredibly seriously as a community. Well, I think in terms of where we are in phase 4, it's exciting that we've gotten here. Thinking back a couple months, it seemed a long way off, as we still had a high number of hospitalizations, a high number of cases being detected every day. So certainly there's reason to be enthusiastic about getting to stage 4. Now, that being said, we have to be cautiously optimistic, because I think the one thing that we've learned from states across the country is that we need to continue to keep the social distancing in place. We need to continue the precautions around meticulous hand washing and avoiding touching our face to really prevent the spread. So certainly there'll be excitement about restaurants reopening, gyms reopening, and things like that. But I want everyone to keep in mind that we still need to make sure that we're wearing masks, washing our hands, because we don't want to be in a situation a few months from now where the cases are beginning to build again, and we're back into phase 3. The million-dollar question as to whether we can anticipate a surge in the fall. I think the best data and science that we followed throughout our entire process tells us that there is a likelihood that there may be a surge. The question is really the degree of a surge that we'll see, if it'll just be this continuation of cases and more of a peak like we've seen before, more this plateau like we've seen before, or if truly there will be a resurgence in cases and the number of cases of COVID. So the concern is certainly that as we relax some of the social distancing and as people grow tired of some of the precautions around masks and hand washing and things like that, those all put us at a higher risk for really having a significant resurgence. So the closer we can stick to those precautions, the less likely we are to have a really significant surge when it comes to the fall. I think the honest answer to that is no one can be certain. What we do know is that as we relax the social distancing, as we reopen as a city and as a state, we need to continue to remain cautious about the social distancing, about wearing masks, about meticulous hand hygiene, because the things that will put us back into a resurgence is if we are growing tired of those types of precautions that we need to take and people start relaxing on that. I think in all likelihood we will see a surge later in the state. Now, that being said, I'm hopeful that if we can maintain the same level of diligence that we've had to this point, I think we may continue to see cases through the summer and fall, but not necessarily see that resurgence of cases like we did earlier this year. Centers for Disease Control will tell us that we certainly want to be sure to continue to wear masks, especially in settings in which we're close to other individuals, so in grocery stores, in pharmacies, when possible in restaurants, obviously not eating, but when possible in restaurants. Anytime you're in a setting with other people, to be on the safe side, it's always better to wear the mask. That's not just to protect you, but also to protect the other individuals that are in that setting as well. I think when you're in isolation, when you're out in forest preserves or places, that you're really isolated and away from everyone else, it is safe to go without, and that really follows with the CDC recommendations to really strictly adhere when there's others around, but you can relax it a little bit when there's truly no one else around. So if I'm wearing a mask, is it important to keep that 6 feet distance, or can I speak more closely with people? And I think the answer to that is the 6 feet is certainly still important. The mask is a great first step, but the 6 feet, that distancing to making sure we're not spreading any respiratory droplets or things like that, the 6 feet is really a good precaution to continue to keep in place for as long as we need to. Another question that frequently comes up is in regard to medications to treat COVID or the vaccinations. And I can tell you that there are some promising trials with medications with promising results, but nothing that is shown to be of any benefit for preventing the onset of COVID. Really, those are more for the treatment of those that are in the hospital with COVID. So again, we closely follow those results and we participate in a number of those trials as well to really try to advance the science around that. The best that we have around vaccinations is that we're looking at very late this calendar year, early next calendar year at the earliest to really have a vaccination. That will really be critically important in making sure that we acquire herd immunity through vaccination, so making sure that we have a mass vaccination when it's available so that there's immunity in the larger community from the spread of COVID. So that's certainly a step that we all look forward to, and I know there's a lot of wonderful work headed in that direction as well.